Welcome back. Great to have you here on WKYT as our new news hour continues. When it comes to ear infections with your pets, getting the proper diagnosis and the correct treatment is very important.
Dr. Butch Schroyer from Animal Care Clinic joins us today. This is a serious problem with pets because they can't tell you that something's going on.
Yeah, it's one of the most common things we see every day. There's not a day doesn't go by that we don't see 2 or 3 dogs or cats that are having an ear problem. And they all look alike typically when we see them. They smell, they're red, they're tender to the touch. So from an owner standpoint, my dog or cat's ear hurts. And the problem is their ears made a little bit differently. So I brought this little picture along to try to show you that what goes on. And everybody sees the ear on the dog here, but in fact the ear canal opens, it goes down and makes almost a 90-degree bend to go to the eardrum. And you and I don't have that vertical shaft, so when we lay down and sleep, we get some drainage out of there, where if a dog or cat lays down, it stays trapped in their ear.
That makes
so they
sense.
can't get drainage, and if they can't get drainage, that's half the battle of getting an infection under control.
So is it more difficult to treat their ear infections, or is there a way to do that?
There are ways to do that, but if it's a tender ear, they may not even let you get in to clean it to get ready to get the medication in. So many times on a really bad ear, we need to get them in, sedate them, get the ear cleaned effectively, and get the right medication in. Now, how do you know what medication? Because you don't know what's causing it. Well, we do things called ear swabs, where we actually take a cotton tip applicator, swab part of the ear to get the debris out there, and we can put it on a microscope slide and look at under the microscope and see, is it yeast that's in there causing the problem? Is it bacteria that's causing the problem? Or is it both that's causing the problem? Or do we not see anything? It's just a bad allergic response that we got to treat. If we know what's causing the problem, then we know how to go about treating.
And can you prevent it if you keep the ears clean and do things like that?
Keeping the ears clean becomes a basis for us. And if you use an ear cleaner, it's fairly straightforward to clean. We can show you ways that you can wet a cotton ball, put the wet cotton ball in the ear, then massage the cotton ball. That way it gets the medicine down into the cleaner. If you use the right cleaner, you don't leave moisture. That keeps the ear clean and dry, and a clean, dry ear stays healthier.
And they're much happier.
Absolutely.
All right, Dr. Butch, thank you.
Thank you.
Good advice as always.